Dear students, welcome to today's live stream. So in this month, we are doing rapid revision MCQ series. So every week, we are trying to solve 10 MCQs from each topic. So today I have chosen hemoglobin structure and function as the topic. So this week we will do the normal part of hemoglobin, that is the structure and function. In the next week we will do the pathologies associated with hemoglobin. Okay, so first of all, tell me, am I audible? Are you able to hear me? Tell me, guys. Okay, so in the meantime, let me introduce Operation NEET PG 2020. So in Operation NEET PG, look at this. I'm going to teach biochemistry 20 hours of live course. So this will be like a revision course. So this is going to help you in solving your doubts as well as a rapid revision course. And there will be 5 hours of live class of MCQ revision. Okay. Okay, you are all able to hear me, right? Good. So we have Manas, Deepan, Vivek Kumar. Good evening everyone. So guys, you give your best and in turn life will give its best. Okay. So many people say that I don't have luck. So what is luck? Luck is nothing but when preparation meets opportunity. So that is called luck. So to have luck, you should first have preparation. Okay, when you have enough preparation and there is opportunity. What is the opportunity? Anything. For example, you are preparing for NEET PG. So opportunity is the date of exam, right? Date of exam. So when preparation meets opportunity, that is called luck. And remember, nothing is impossible. Nothing is impossible, because look at the word impossible. Impossible itself has I am possible. Okay, so everything is possible, guys. Don't worry, you just prepare for the exams well. So if you like to take the plus subscription, because there are a lot of good features in the plus subscription, if you want to take it, you can use my code Dr. Karthi to get 10% instant discount in the subscription amount. So with this, let's start the first question. So there are 10 questions. So let's start the first question. The highest level of protein structure seen in myoglobin is primary, secondary, tertiary and quaternary. Tell me, which is the highest level? Manas Tripathi, good to see you in this session. Good. Manas, you could not come to that biochemical pharmacology session, right? Deepan is saying tertiary. Sneha is saying tertiary. Let's see. What about others? Okay, Jaiki is saying quaternary. Dr. J Rock, DJ Rock. Okay, DJ Rockstar is saying tertiary. Abhinaya, Aishwarya, Reshma. Okay, Reshma is saying quaternary. First of all, let's revise all these things. What is primary structure? Primary structure is nothing but sequence of amino acids linked by peptide bond. Okay, from amino terminal to carboxy terminal. So that is your primary structure. Okay, so that will be there obviously in myoglobin. Secondary structure is alpha helix and beta sheets. So there are alpha helices in myoglobin that you have. Okay. So tertiary structure is the three-dimensional arrangement of this. So that will also obviously there in myoglobin. What is quaternary structure? You get quaternary structure when you have multiple subunits, right? When you have multiple subunits. For example, let me draw a protein. So this has two regulatory subunits and two catalytic subunits. Can you identify this protein? We call this as R2C2. This protein is involved in signal transduction. Can you identify this? Let me give more clue. Cyclic AMP will go and bind to this protein. So look at this. Cyclic AMP will go and bind to this protein. So once cyclic AMP goes and binds to this protein, what happens? The regulatory subunits, they dissociate from the catalytic subunits. So catalytic subunits are freed. Excellent, Deepan. So this is your protein kinase A. Okay, I'm glad that someone found the answer. So this is protein kinase. Are you getting the point? Why I am saying this is protein kinase? Protein kinase, that too A. A for cyclic AMP, right? Good, Aishwarya, nice. Okay. So for hemoglobin, you have this quaternary structure. This is adult hemoglobin alpha 2, beta 2. If it is fetal hemoglobin, alpha 2, gamma 2. Upmanyu Chaudhary, welcome to the session. So quaternary structure is possible only when you have multiple subunits. For proteins like myoglobin, albumin is a single protein, right? It's a monomeric. Okay. So for albumin, no quaternary structure. Right? No quaternary structure is possible for proteins like albumin, myoglobin and all. Clear? So the highest level of structure found in myoglobin is tertiary. Those who has chosen quaternary, please note down. Let's go to the second question. The major hemoglobin present in RBCs in normal adult is which one of the following? So which one is the major hemoglobin present in the normal adults? Tell me which one? Okay, Sneha, Deepan, Abhiraz, welcome to the class. Please try to answer this. Okay, so here people have confusion between option B and option D. So what is HbA2? A2 is alpha 2 delta alpha 2 delta 2, right? So that is your HbA2. What is HbA? HbA means alpha 2 beta 2. A1C and A1B, these are glycosylated hemoglobin, which are subtypes of HbA. So these are all glycosylated not glycosylated. Why? Glycosylation means enzymatic addition. Okay, so glycosylation is a wrong term. In many textbooks you will see that they mention this as a glycosylated. So it is not glycosylated, it is glycated. Glycation means non-enzymatic addition. Okay, glycosylation means enzymatic addition. Glycation means non-enzymatic. So HbA1c, HbA1b, and there are other subtypes, HbA1a. So these are all glycated hemoglobins. Okay, HbA1c is the most abundant glycated hemoglobin. Normally less than how much percentage, guys? Less than 6.5 percentage should be there. If the HbA1c is more than 6.5 percentage, that indicates the person is suffering from diabetes mellitus. Right? Good, Aishwarya. So the most abundant one is HbA, adult hemoglobin, right? So this is obvious. So this A1 is nothing but both are same only. So HbA, we call them as sometimes HbA1. Okay, Dr. Kagesh. So it's same only, right? So HbA sometimes we write as HbA1. Okay, let's move to the next question. Any doubts? Feel free to ask me. True statement about adult hemoglobin is. Answer this. Homotetramer. So adult hemoglobin, that is the normal hemoglobin. So that is your adult hemoglobin. So this is the easiest question. You can answer it instantaneously. Answer this instantaneously. Yes, so I am getting instant answers. Good. So just now we have seen, right? Adult hemoglobin is alpha 2, beta 2. So it is not a homotetramer. So which one is a homotetramer, guys? HB bots. Have you heard of this one? HB bots. So HB bots, it's seen in pathological condition. HB bots is the homotetramer. Each hemoglobin molecule binds to how many oxygens? 4 oxygen molecules. Each hemoglobin has 4 heme, obviously. So there will be 4 heme. That is why it binds to 4 oxygen molecule. So this is the easiest one. Let's go to the next one. Right? It is not homotetramer, Anas. It is alpha to beta 2, na? So this is the correct one, right? So it is not homo, na? It is hetero, right? Clear? It is a heterotetramer, na? Adult hemoglobin. Clear, Anas? Right? So A is not the true statement. Okay, they are asking about adult hemoglobin. So HB bots, I told, that is seen in pathological condition. In the next week we will see HB bots. Okay, let's move to the next one. Quaternary structure of Portland hemoglobin is. So I have given the answer here itself. So I want you to see and answer. So it is like an open book exam. Answer this. Open book exam. Answer. Look at this and answer fast. Tejas, Manas, Deepan. What about others? Nice. Kagesh Yadav. Yeah. So the whole purpose of me giving is so that you will know this question. So this has been asked once. So it is a purely memory based question only. But still I want you to know this. So what are these Portland, Gover2, all these things? So these are all embryonic hemoglobin. So this is your fetal hemoglobin. These are all embryonic hemoglobin. Okay. So in adults, you have fetal hemoglobin 1%. Around 1% you will have fetal hemoglobin, but you won't have these embryonic hemoglobin and all. Okay, so you won't have this. So this chain transition happens, right? So in adults only you have A to B2 now. But look at this, in Gover 1 you don't have alpha or beta chain. So here also Portland you don't have alpha or beta. So the chain transition happens. So see this, gamma 2 comes, then in fetal gamma 2 there, ultimately it will be replaced by beta 2, right? So these are all embryonic, then fetal, then adult hemoglobin comes. Another easy question, the shape of oxygen dissociation curve of myoglobin. Oxygen dissociation curve means ODC. So ODC curve, the question is asking about ODC curve. Tejas, look it carefully. The question is asking about myoglobin. Tejas, revise your answer. Not for hemoglobin. Okay. So for hemoglobin only you have sigmoid. Clear? For hemoglobin you have sigmoid shape. What is the reason for this sigmoid shape? It's because of cooperativity. It's because of allosteric nature. Okay, so allosteric nature of hemoglobin. Only hemoglobin has 4 subunits, right, compared to myoglobin. Myoglobin is having only a single subunit. So there is no possibility of cooperativity, no Bohr effect, nothing will be there. Because there is no quaternary structure in myoglobin. As there is no cooperativity, there is no sigmoidal curve, right? So that is why in oxygen dissociation curve for myoglobin will be hyperbolic. Okay, so obviously circular you can rule out, so it cannot be a circular curve. Okay, so this option is like a very easy option, so you can easily exclude this, right? Clear, right? If there is any doubt you ask me. Manas, now is it clear? Myoglobin is monomeric, right? So that's why it won't have sigmoidal. Clear? What is the role of myoglobin? Myoglobin is an oxygen reservoir. Myoglobin is oxygen reservoir. P50 value for myoglobin is very, very less. Okay, so it gets saturated in a very, very low oxygen pressure, right? So it's around 2 tar. So we use 2 tar, right? Good Tejas. Nice. Let's move ahead. Binding of carbon monoxide, that is CO, to iron of hemoglobin is hindered by, unfavored by, because of steric hindrance provided by which of the following? Listed in E7, E8, F7, F8. Look at this, E7, E8, F7, F8. So it is like number game. Answer this. You answer this. By this time, let me tell you certain things. In any globular protein, in the outside you will have hydrophilic amino acid. Okay, in the outside you will have hydrophilic amino acids because they are all exposed to water, right? They are exposed to water. In the core you will have hydrophobic amino acid. This makes sense. The core should have hydrophobic amino acid. But our hemoglobin is kind of exception. So in the core of the hemoglobin, you find certain hydrophilic or polar amino acid, histidine. Is this clear? Normally, any globular proteins won't have polar amino acids inside the core, but hemoglobin has two particular histidine residues in the core of the molecule. What is the role of this core of the core histidines? So compared to heme molecules, so the one histidine which is linked to the iron of the heme is known as proximal histidine. So proximal histidine is a histidine which is linked covalently to iron of the heme. Okay, so this is histidine. So this histidine is there in helix F in the 8th position. So proximal histidine is F8. The other histidine which is distal, it is not covalently linked, so that is known as distal histidine. Right, so this is your distal histidine which is not covalently linked. So distal histidine is histidine E7. So it is E7. Okay, so D for E. Remember DE. So in the alphabets, D and E are nearby, right? So distal histidine is nearby. So let me tell you an easy way. Carbon monoxide, CO, C, right? Distal histidine, D, E7. So remember like this, CDE, right? So carbon monoxide binding is prevented by the steric hindrance provided by histidine E7. Is this clear? Simple, right? CDE. So carbon monoxide, distal histidine and E7. What is the role of proximal histidine? That is your F8. That binds covalently. Okay, so this binds covalently to your heme iron, right? So in a congenital methemoglobinemia, in that condition, there is mutation. This histidine, instead of this histidine F8, there will be tyrosine. As histidine is not there, ferrous iron will be converted into ferric iron. So there is methemoglobin production. Okay, Prashant is asking what is F8. See here in the hemoglobin, here you have helices. Okay, so in the alpha and beta you have helices. So compared to alpha and beta, one helix, alpha helix. So you have alpha helix. So the difference between alpha and beta is one helix is less. Okay, so don't worry, no need to go into very deep into this. But let me tell you, as you have asked, what is this E, F and all? So the helices are named like this: A, B, C, D, E, F. Okay, so each and every helix has a name. Clear? So in this amino acids, we are like in the helix B, amino acids we name as 1, 2, 3, 4 like that. Okay, so that is why E7 means in the helix E in the 7th position. Prashant Kumar, is this clear for you? F8 means in the helix F in the 8th position, 8th amino acid. Okay, I hope you got this point. See the structure of hemoglobin, you will see helices. So helix, it will be like helix will be going, right? Shall we move ahead? Prashant, is this clear? Okay. Another question, easiest question. How much oxygen can be carried by 1 deciliter? Good Deepan, that you understood. 1 deciliter of blood with 15 gram of hemoglobin. So in 1 deciliter blood you have 15 gram of hemoglobin. So total how much oxygen can be carried out? It's a kind of physiology question. So biochemistry, physiology, they're all. So first tell me, 1 gram of hemoglobin can carry how much oxygen? How many ml of oxygen? So if you know that, you can answer anything. 1 gram of hemoglobin will bind to, excellent Dr. Deepan, 1.34 ml of oxygen. So 1.34 into 15. So what will you get? You will get 20 point something like this. Okay. So the answer is 20 ml of oxygen. What is deciliter? What do you understand by deciliter? Deciliter means 100 ml. Okay, deci means 100, deciliter means 100 ml. Okay, right. So deci means 10 to the power of minus 1, right? Because liter is 10 to the power 3, right? So deci means 100 ml. Good everyone. Let's move to the next question. Increased oxygen affinity of fetal hemoglobin compared to adult hemoglobin can be explained by which of the following? Answer this. See, I tried to confuse you. Sorry for this. I made like this. Alpha chain of fetal hemoglobin cannot bind to 2,3-BPG efficiently. Okay. So 2,3-BPG is produced by a glycolytic shunt pathway called as Rappaport-Lubering shunt. You know that 2,3-bisphosphoglyceric acid. It is a negatively charged molecule. It's negatively charged. So this negatively charged molecule will come and bind to the central cleft in the hemoglobin. Okay, especially it is going to come and bind to the positively charged residues in the beta chain. Okay, it is in the beta chain. So your gamma chain does not have that positively charged residues. Clear? So gamma chain does not have that positively charged residues like histidine, lysine and all. Okay. So 2,3-BPG cannot come and efficiently bind to the gamma chain of HbF. So that is why if you see in the placenta, you have maternal blood and you have fetal blood. You have fetal blood. The oxygen is transferred from the maternal blood to fetal blood, not in the reverse direction. Why? It is because of this only. It is because of this reason only. In maternal blood, you have adult hemoglobin. In fetal blood, you have HbF. Okay, so HbF has more oxygen affinity because 2,3-BPG binding is not there. So 2,3-BPG is an oxygen unloader, right? So it's not going to unload the oxygen. So HbA 2,3-BPG will come and bind. It will unload the oxygen. So this unloaded oxygen will be carried by fetal hemoglobin very effectively, because HbF has more oxygen affinity. Is this clear? This is clear, right? So in placenta, the oxygen always goes from mother to fetus, not in the reverse direction. Okay, the answer is good that someone noticed. So the answer is what? Answer is option D. Gamma chain of fetal hemoglobin cannot bind. So that is the reason. Tipan, you told option C. C. So the answer is option D. Okay, so the gamma chain cannot bind. So sometimes sometimes the teachers also get carried away when some excellent student is there. So when some student is answering correctly, then we see that okay, it must be the correct answer. Okay, clear everyone? The answer is D. Aishwarya Verma, excellent that you pointed out. Good. Okay, another easy question. Cyanosis appears if deoxyhemoglobin level is more than. Okay, Tipan, now you know this. So good. Okay. So in patients of severe anemia, you won't have cyanosis. So in physiology, this is also a favorite Viva question. In patients of severe anemia, you won't find any cyanosis. Why? That's what they ask you in exam. This is the reason. The reason is, for cyanosis to appear, you should have at least more than 5 gram per deciliters of deoxyhemoglobin. Then only cyanosis will appear. In severe anemia, the total hemoglobin itself is less than 5 gram per deciliter. Then how will you get cyanosis? Clear? So this is the reason why you won't have cyanosis in patients of severe anemia. Okay, let's conclude with this question. So it's been more than 30 minutes. Let's conclude this. Another number based question. Alpha globin is made up of dash amino acids encoded by chromosome dash. So guys, you join our Unacademy NEET PG live Telegram group. So join this Telegram group, Unacademy NEET PG. So next week also I will be coming exactly 8 p.m. Saturdays. Okay, Manas, don't worry. This is just a memory based question. Anyone else? Anyone can answer? So how I remember is alpha chain coded by chromosome 16, beta coded by chromosome 11. Right? Then I remember, so this is here 6 is there, then you will have 1 here, 141. Beta 11, right? So 146. See, this is how I used to remember easily. So 16, then here you will put 1 here. So here if 1 is there, here 6 will be there. 6 and 1 interchanged. Clear? So remember alpha 16, beta 11. So alpha thalassemia, which chromosome will be involved? The defect will be there in the chromosome 16. Beta thalassemia, the defect will be in chromosome 11. Number of amino acids, it's very simple. Alpha 16, 141. Here it will be 146. Okay, simple. It's easy to remember. So now if you go this, alpha globin is made up of amino acids encoded by chromosome. So alpha 16 I told you na. Alpha 16. So the amino acid number will be 141. Okay, so go here, option C will be the answer, right? So guys, it was a great session because of all of your participation. So it's all because of your active, enthusiastic participation. Again, remember, nothing is impossible because the word impossible itself has I am possible, right? So see you in the next YouTube session on the coming Saturday 8 p.m. Bye. So what you have to study? Study the pathologies of hemoglobin. Okay, I am giving you the topic, pathologies associated with hemoglobin. Bye everyone. Enjoy your weekend.